wanna see me dancing with somebody. If you wanna believe that anything could stop me, don't show up, don't come out, don't start caring about me now.
I wanted to welcome everyone to our program tonight. I'm very excited to open our program, our PACE-bound program, on behalf of the College of Health Professions, the Bachelor in Science in Health Science. And we have an exciting program tonight, including presentations from faculty and students, and we have our student advisors on hand as well to field questions and coordinate our panel, and we have representatives from the admissions office as well. So let's get started. So I am Erika Gollum. I am Associate Professor in the Health Science program. I've been at PACE for about 4 years. As you must know, this is we are a bi-campus program, and we were launched in 2015. So we've just actually graduated our first class last year. It's very exciting, in May 2019. And we have approximately just over 200 students currently enrolled in our program. This is the page of the full-time faculty. We're on 2 different campuses. We have Dr. Amaya and Dr. Mendelson in the New York City campus, who also teach in Pleasantville, and myself and Cheryl Scalzo at the Pleasantville campus as a home office, and we also teach in New York City. We also have quite a number of adjunct faculty in addition to allow for courses and teach specialty courses such as genetics and healthcare, telehealth, and some leadership and management courses. So as you probably know, but I'm going to review that the Bachelor's in Health Science gives you a choice of 3 tracks. So there's the Generalist Track, the PreNursing Track, and the PrePA Assistant, the PrePA Track. The Generalist Track is really for those who plan to pursue a career in public health, in healthcare administration, in healthcare policy, or other non-clinical. And the PreNursing Track is for students who plan to pursue entrance to an accelerated post-bac nursing program. And finally, the PrePA Assistant Track, the PrePA Track is for students who plan to pursue entrance to a graduate PA program. We'll take questions at the end of the slides, if you don't mind. Thank you. So we're all very excited and pleased that you've chosen this program. I just want to sort of come back to remind ourselves and situate ourselves as to why students would choose a degree in health science at PACE. We have a flexible interdisciplinary approach to learning about health sciences in the healthcare field. In fact, we have a substantial emphasis on cross-disciplinary learning and integrating a liberal arts flavor, which offers a great complement to a strictly preclinical program. We have small class sizes, approximately 20 to 25 students in our major courses, and we provide preparation in essential topics such as healthcare policy, ethics, disease prevention, global health, innovation, and telehealth. We offer senior year internship and capstone as a sort of a joint experiential learning and a seminar course together that is supported by the PACE University Career Services Department. And we offer pre-professional preparation for PA and accelerated nursing programs and pathways to other health-related fields such as social work or public health. We also have a very committed academic advisement team, and you'll hear from them a little later in the presentation. So where to? Where do our students go? The program actually prepares students for a variety of careers in healthcare, including positions in the following fields: in hospitals and private medical offices, in governmental and community agencies, in non-governmental organizations, in global health organizations, public health departments, and philanthropic health organizations, to name a few. I can share with you a couple of examples of where our first graduating class went and advanced to. Just to give you a few ideas of what our alumni have been doing, one of our alumni works as a planning liaison with the New York City Department of Social Services Emergency Management section, addressing the needs of the homeless population during the COVID crisis. Another is attending the ABSN program at PACE currently. And yet another is doing research at a private medical office in New York City while studying for her MCATs and plans to go to medical school. And yet another one is researching at Columbia University Health Science campus on a very interesting set of research topics. So I think that gives you an idea of the spread of where our students have gone and an idea of where they may go on to. Also, our current seniors are going to a lot of exciting places right now, checking in with the senior group. Just to name a few, one has been accepted to the Columbia University Mailman School of Public Health. We have another on her way to the PhD nursing program at Columbia. Yet another at NYU, accepted at NYU nursing program. We have several students who have been accepted at the PACE nursing program. And one of our student panelists, in fact, was accepted at the New York Institute of Technology PA school. So she'll talk about that perhaps on the student panel in a little bit. So a bit more about the construction of our Bachelor's of Science. What happens when you get in the program is you do first choose a track. So as I said, we have 3 tracks, and they consist of Generalist program, a PreNursing, and a Pre-Physician Assistant program. And then you will choose a concentration, usually by the end of your sophomore year, so it gives you time. The Generalist and the Pre-Nursing students select 2 concentrations, and the PrePA students select 1 concentration, mostly due to the longer list of science, basic science and math courses that need to be taken for that program. So the concentrations that we offer at present are in global health and in health policy and advocacy. Our core, which consists of 30 credits, is a list, a variety of courses that students in all tracks will take. And that will make up their core, including topics such as healthcare ethics, global health, which we call healthcare for diverse populations, introduction to epidemiology, introduction to health promotion and disease prevention, and healthcare policy. Now, in the Generalist track, these are for students who plan to pursue a career in healthcare administration or public health. And required courses include the following: the core, which I've just mentioned for 60 credits, the PACE University core, and then the health science core, which I've just mentioned for 30 credits. The students will complete 2 concentrations consisting of 30 credits, and then the senior capstone and internship. So that's sort of the kind of partition of what the student on a Generalist track will be responsible for. On the Pre-Nursing track, which we offer in Pleasantville only, this track is for students planning to pursue entrance to an accelerated nursing program. And thus the required courses include the following: the PACE University core, which includes a prerequisite science core, so a bit additional to the PACE University, the Generalists. The health science core for 30 credits that we mentioned in the prior slide, and 2 concentrations, the global health and health policy and advocacy. Then also the senior year capstone and internship, which is part of our senior year rollout. On the PrePA track, these are for students planning to pursue entrance to a PA program. And the required courses include a bit more in this case. So the Pace University core, including a prerequisite science core, which consists of biology, 2 biology courses, chemistry, general anatomy and physiology, microbiology, and organic chemistry. So that's a longer list. The health science core for 30 credits, and one of the concentrations. So students in the PrePA track will choose between global health and health policy and advocacy for their concentration courses. And then those students will also complete a senior year capstone and internship. So part of our program, as I've mentioned, is the senior year capstone and internship. And we have a robust program that we are now in our 2nd year of offering. We collaborate with the Career Services at PACE, and Career Services offers quite a bit of services and preparation for students to get them market ready, and including on-campus interviewing and employer spotlights programs to prep students, and inviting employers to the campus to meet health science candidates graduating in May. So some of the places where students have found internships and worked in these past 2 years include the Academy of Medical and Public Health Services, Urgent Care Services, the New York State PI or Psychiatric Institute at Columbia as an intern, the organization Hunger Free America, Kendall on Hudson as a Vitalize 360 coach, their particular program, a session assistant intern at Memorial Sloan Kettering Cancer Center, and at Westchester Medical Center we also have interns. We've also had one go and work at the YMCA. So you can see that the internships are actually broad ranging and rich, and they respond to our program objectives. These are a little bit more, a couple of more snapshots of Career Services working with students and mentoring students to get them market ready, to prepare them for interviewing for their internships, and kind of some of these services that students can take advantage of, including resume and cover letter review, skills building, mock interviews, professional networking, and digital branding workshops that they can attend. Okay, so I wanted to put a slide up for contacts. You might actually, those of you in the audience might want to take a photo of this slide in order to reach out for any questions you might have later. I am then going to turn to introduce a couple of the students on our wonderful panel tonight, and I will let Liz Colon, our Associate Director of Academic Advising, take over at that point. So please do, I'm going to leave this slide up for another couple of seconds to take a picture of these contacts in case you want to reach out with questions after the panel ends. Okay. Okay, so now I'd like to introduce briefly our student panel. So we have quite a nice panel tonight of wonderful students from the program who will, I think, say a little bit about themselves and then be available to answer your questions from the audience. We have Danielle Vaiano, who's a senior on the Pleasantville campus. She's in the PrePA track, and she, in fact, is interning at Westchester Medical Center. She has been involved in sports. She was a 2-year captain of the volleyball team. She has various volunteer activities on and off campus, including with the Pleasantville Volunteer Ambulance Corps, and has served as a mentor on campus for student athletes. She is also, Danielle, headed to the New York Institute of Technology PA school next year, so we're proud of her. And next we have Chelsea Covino, Also on the Pleasantville campus, a junior in the PrePA track. Chelsea played lacrosse for the first about 2 years at Pace, and volunteers at the Westchester Medical Center as well. She volunteers also at other organizations in the community, including a rape crisis hotline, and works as a medical assistant as well. She has lots of activities she can talk to you about. Then we have Mary Kate Lonigan, also from the Pleasantville campus, who's a senior on the Generalist Track. She has been a 4-year member of the PACE women's lacrosse team and is also a fitness trainer, and is hoping to head towards, once she completes her academic credits, to a master's in nutrition as her next stop after she completes her bachelor's. And finally, we have Raven Vaughn, who's actually from the New York City campus, a junior in the Generalist Track, and in the health policy and advocacy concentration. And Raven has served as the vice president of the Student Government Association. That's something that you can also ask her about, and has participated in numerous volunteer activities in healthcare in the community, including a medical scribe in the ER at Mount Sinai in Queens. So we really have quite an illustrious student panel, and looking forward to having them speak and having your questions. I will now turn it over to Liz Colon, who will moderate the panel. And Liz is the Associate Director of Advising. Thank you so much for your attention. I'll turn it to you, Liz.
So thank you so much for joining us tonight. We wanted to get you an opportunity to hear from some of our students so that you get a better sense of what it is to be a PACE student. So we'll start with, I think, a question that a lot of you may be interested in is making that transition to freshman year, and the reasons why you chose PACE. So I'll go back to my student panel, and if any one of you want to start, just to give students an idea of why you're here and what you were interested in.
So again, my name is Danielle and I'm a senior. So I chose PACE mostly for the opportunities that everyone had talked about, not only during undergrad, but post-undergrad, where I knew I wanted to go into a PA program. And unfortunately, PACE didn't have one at the time, but in 2016, they did create one, which was really exciting for me to see that that was an option at PACE then. And really the small class sizes was a big thing for me, and being able to, really get to know my teachers and get to know all my classmates as well, because some of my classes are, maybe 12 to 15 people, and then you really get to know all of the other health science students.
All right, I can go next. So I chose PACE for the same reason Danielle did, which was the small classes that I really enjoy. And honestly, after going to PACE and being here for a while, I've realized that they have great professors, great advisors that really do end up, they want to work with you. They want to work with you one-on-one. You don't get that at a big school where they, you go in, you go out, that's it. They all know you on a personal level at this school. And I think that's really what kept me at PACE, and I absolutely adore this school.
Hi everyone, I'm Raven. Same here. I just love the small class sizes, the really tight-knit community, and also the information that you can learn with this major. It's not just a traditional science like biology or chemistry major. You get so many important backgrounds, such as epidemiology, which is a class that I'm in right now with Dr. Gollum, and it's amazing, especially considering the current pandemic. And so you really get a wide variety of knowledge in this major, which is very beneficial.
I can go next. My name is Mary Kate. I chose PACE because, for one, I have to agree with the small class sizes. I feel like we're really fortunate to have small class sizes because we all have, I feel like every professor that I've had a class with, I've had a unique connection and like a personal connection with, and it makes it really easy to do well in classes that way. And also, I think it's really special being how close we are to New York City, which there are a lot, and Westchester, where there are a lot of job opportunities, especially in health science. So that's another big bonus of going to school at Pace.
So one of the questions that one of the students had was about your track. So can you talk about how you decided on the track that you were interested in, that you're in now?
So I'm on the pre-PA track, and I had gone in knowing that I wanted to go to PA school, and I kind of switched with med school and PA school throughout my journey, but ultimately stuck with attending PA school.
Yeah, I also knew going in, I probably knew since I was 7 that I was going to be a PA, and I really liked this program because I knew it didn't have any extra courses like bio classes where I would have to take organic chemistry too, where PA programs don't, actually most PA programs don't require that, just certain classes that PA schools don't require, and that's why I really enjoyed the pre-PA track where there was no unnecessary courses that I needed to take.
So with me personally, I chose the generalist track. I hope to one day apply to a med school program. With my situation, there's a lot of med schools that say to choose a major that you know you'll excel in, not one that's gonna, pose unnecessary stresses for you and challenges. And so with the generalist track, I feel like I get a nice broad education, and then I can also take some of the prereqs that med schools require, or apply to ones that take a more holistic approach and look at you as an overall applicant versus just the classes that you took.
I chose the generalist track because I'm hoping to go for my master's in nutrition. I want to become a registered dietitian. So the generalist track offers health science courses on both the policy and the global level. So that helps me ensure that I'll get all my prerequisites in order to apply for the master's program.
Can you guys talk about the sort of balance that you have received both from, the various classes that you've taken while at Pace, as well as the other experiences that you had, whether you've studied abroad or you're part of an organization? Just talk about your experience as a Pace student in balancing both of those aspects.
So I think that's probably one of the hardest things to learn as an incoming freshman is how to balance and how to kind of transition in from high school to college. Like we were talking about with the small class sizes, that's really helpful because you're able to make friends that you're going to be with for 4 years in those classes, working on small projects with them and stuff like that. I also was fortunate enough to study abroad in Costa Rica with the health science program, and it was amazing. Such a great opportunity. If you can study abroad, definitely do it. That was my first time out of the country, and it was just great to see all of the different ways that they do like their medicine there. I'm also on the volleyball team, so that transition was also hard, having to be away for the weekend or travel, and you really learn how to manage your time and how to be independent because you have to speak with your professors and notify them ahead of time that you're going to miss class or that you're going to be leaving early, and then make sure that you're getting in the work before time. So it's really just learning about yourself and understanding how you work as a student.
So my biggest advice that I can give to everyone here is if you're doing pre-PA, anything like that, get your certificate in something that you can get medical hours in now. Because if you don't, you're going to be rushing through college. You have a million other things you need to do. That summer before going into college, I suggest doing an EMT program, a phlebotomy program, because you have the stress of college where you want to have that certificate under your belt so you can start working to build up medical hours. That's my biggest advice. And I also studied abroad like Danielle. I went to Costa Rica. It was an amazing experience. And I'm sorry, Liz, what was the other? I feel like you had more to say about this topic. I'm sorry.
Oh, no, just if you're doing any sort of student organizations within PACE.
Okay, yes. So I also I volunteer at Westchester Medical, and I do the SAVE program. That's an amazing program. I recommend to anyone else who's coming up to PACE in Westchester, because you work as a 24/7 hotline for women or anyone who has been raped or had a situation like that. And it's, again, going into that program, I met a lot of people. I made a lot of connections, and that's another thing. Make a lot of connections. Go to Westchester Medical. Go and see where you can get your foot in the door. And I think that's just the biggest thing for everyone.
So with school life balance, I think that your freshman year is really good to get into a routine and separate when you're going to have time for, friends and getting to know people, and when you're going to devote time to doing schoolwork. And in college, it just has to be, whatever works for you. For me personally, doing a little bit of work every day throughout the week can help than rather just saving it for the weekend and it piles up, because you can't really learn and excel that way. And for student organizations, I am in SGA, and we basically advocate for students on campus and basically better their experiences. And so I'm the vice president of the College of Health Professions. And one of the things we did last semester is we held a town hall for students during advisement period, especially for freshmen and sophomores, if they were confused about who their advisor was or what classes to register for. And so we did that and helped them with that. And then we also held office hours for students to come talk to us and ask us if we needed anything. The president, Chelsea, and I, we were going to plan a very fun implicit bias event this semester, but unfortunately that got canceled due to the pandemic. So we're trying to figure out an alternative for that to make it virtual. And so, yeah, it's a really good student organization. You get very great leadership skills, and you also get to advocate for your fellow peers. So I would recommend.
Yeah, just touching upon and adding on what the previous student said, it is difficult, and it's going to be difficult to balance everything. It's hard to balance academics with your health, your social life, your family life, whatever's going on at home. I would suggest starting out, like as it was previously said, getting in a routine. So getting a calendar or making sure you have a planner to balance all your classes, because it's different from high school where your teachers are constantly reminding you of assignments and stuff like that. Not all professors remind you of future assignments. You need to make sure that you're writing them down and keeping track of them. I also studied abroad. I went to Greece. So PACE offers these really cool programs. It's called faculty-led study abroad programs. So I'm kind of a homebody. I'm a home-oriented person. So I really wanted to study abroad, but I didn't know if I would be able to go for an entire semester or something like that. So my program was only 2 weeks long. I went with a professor from the PACE faculty, and it was a really great experience. I think it's so cool because not as many colleges offer that 2-week opportunity. A lot of them are first semester, and that can be a lot for many students, especially just coming into college. So there was that. And then I also am a member of the PACE Women's Lacrosse team. So it was challenging at first, especially as a freshman, to balance it all, because I was putting in 20 to 25 hours of lacrosse a week on top of that with academics. But then again, that's why we're lucky to have that those small classes, because we have the opportunity to develop relationships with our professors. As many other schools, you're in lectures and classes with 30 plus people, so you don't really have that personal relationship to a professor. So that was really helpful to have that relationship with my professors, because they were understanding when I couldn't attend class or I needed extra help or I had questions about things because I had missed class for lacrosse games.
We have a question in the chat. Can you talk, the two that are pre-PA, can you talk about how you just made the decision between doing pre-PA, doing PA, and then doing an accelerated nursing program instead? If you ever.
I actually hadn't thought about doing nursing. I had really only thought about going to med school or doing PA. So yeah.
I bounced back a little bit in between high school. I really knew I wanted to be a PA, but I was, again, maybe nursing. I'm not 100% sure. So my senior thesis in high school was, what should I do, NP or PA? And when it came down to it, I did like a lot of research. I come to find out that I would be best suited to be a PA.
one more thing from the panel, from the chat, sorry. Can you also talk about how, about your actual class sizes? So versus health science versus sciences, as well as sort of your interactions with health science faculty.
So I feel like an average class size is like 20s for health science, usually like 19 to 25. It's really not a lot. Sometimes it's even less than that. But I was in a nursing class for microbiology, and that had about 120 students in it. So that was a big difference. And you can kind of tell that the professor would lose people a lot of times because, it was this giant lecture hall. But when we're in our health science classes, it's really easy to stay engaged because the professor is, right in front of you talking. And yeah, basically it's just a really small class size, and they're able to communicate with you and get to know you. You're not really just sitting in the back of the classroom.
Even in some of the bigger size classes I've had, I know my chem and my bio were both maybe 100 to 90 kids, something around there. The teacher still knew who you were and they really didn't want to care, but that's because I reached out. So if you reach out to these classes that have a lot of people, that's my suggestion, saying, hi, I'm in this class. Can we meet just to talk about, maybe before the test or something like that? And they'll know and they'll see that you reach out to you. So that's the best advice I can give you for large classes.
Yeah, the health science classes, some of them, they're like 20 max, but they're much smaller than that usually, and especially once you get further on in your major and concentration. But just like Chelsea said, just reaching out to your professor, taking the initiative, you can do well in any class that you put your mind to. It just depends on you and your work ethic.
Also with the professors, so I've had courses with the same professors numerous times. Professor Gollum, I've had her in one of her classes right now, but this is I think the third or fourth time I've had her as a professor, which is also good because that's another way that you develop that relationship. So make sure that, I don't want to sound like your parent, but you're sitting in the front and you're becoming engaged in class, because it really does pay off, because chances are your professor is going to be someone like a professor that you'll have in the future. So it's important to develop a good relationship with them.
I wanted to add one more thing onto that is the health science program doesn't have that many online courses, which I was really excited about because I am not a fan of online courses. I like that face-to-face interaction. So that's also a plus for me for health science.
So now I'm not sure, are any of you in the honors program?
I am.
You are. So we had a question about the Honors College involvement. So just sort of the types of things that you do with the Honors College versus what you're doing with your regular health science classes and sciences. If you can talk to that, Danielle.
Yeah, so with honors, you need 8 honors courses, and you're allowed 2 honors options, which is you choose the class and you fill out the form that you choose a non-honors class and you basically make it an honors class, but there are certain requirements that you'd have to look into, like the level of the class and stuff like that, and you'd also have to get approval from the honors college. So I have been fortunate enough to make 2 health science classes honors classes, and it does become difficult to juggle all the classes and be able to fit in, all your honors classes and all your health science classes. But there are a lot of courses that will count for multiple things, which is really good. And there are a lot of like only honors courses. So there'll be like an only honors English course. So that way you can make sure you can get that credit. Oh, and one more thing. For the study abroad, honors gives you a scholarship. So definitely use that if you're in. They'll give you a scholarship to study abroad, which is really nice.
And I also know that you can use one of your, if you do a study abroad, you can use that as one of your honors courses that you have to complete. So that's a great opportunity. So I think we're coming to the end, but do you have any sort of final words that you would give a brand new student coming to PACE?
Make sure you call your parents. You know, they're going through this as well, and they miss you. And you know, this may be for them the first time that a child of theirs is leaving home, and just, you know, and also don't be afraid to branch out and make new friends, and you know, have that social life, because like, you know, I'm a senior and I unfortunately don't get to have the rest of my senior year. So, you know, you want to make sure you take everything day by day and don't let anything slip through.
Definitely come in with a big open mind. It's college. Don't think like, oh, joining this club, I'm gonna be like a loser. Like, no, you're not. Do everything possible. Join the club, join the team, do whatever you physically can. You make as many friends as you can, and just have a really good time. Enjoy. It's college.
I would say like get excited, be happy. A lot of students, you know, in other majors, they don't get to learn about the healthcare and medicine like field until they go into their graduate program. We get to learn about these things now. So be excited. You're really lucky to get to be in this program and learn about these things.
Yeah, I agree. Like what Chelsea was saying, just enjoy yourself, have fun, because college is supposed to be the best 4 years of your life, and it's going to be stressful, and you're going to have to cram in studying for one course and writing a final paper for another in one night, and it's going to be stressful, but just do what you're supposed to do. Keep in touch with your professors, make good relationships, make friends, and just have a good time, because you're going to be working for the rest of your life, and these 4 years are supposed to be the best, so enjoy it.
Thank you so much for participating. So I'm going to pass it right back to Erika, to Dr. Gollum, so that she can close out our session for today.
Thank you very much, Liz. Appreciate it. And the students, I'm just so proud of all of you students, and I'm so excited for you. And it was really a pleasure to hear your experiences and that you could share with our participants, our attendants today. I just wanted to thank everyone for attending and coming and listening attentively, and for all your questions. And I did want to encourage you, if you had anything in terms of follow-up as you're sort of processing our panel and our discussion today, to please write to one of the contact addresses that was on the end of our PowerPoint slides. And I'm very excited for the students who have been accepted into the program, and we really look forward to seeing you in the fall. Thank you so much, everyone. Thanks to the panelists. Thanks to everyone who attended. And see you soon. Have a good night. Thanks. Stay safe.